Hello, happy Saturday, everybody. I'm sure everyone is either all done with their sports for today, either taking their kids or participating, getting some rest that they may need. And I'm Dr. Lauren Dolan here, talking about a four-letter word that no parent or athlete wants to hear, and that's the word tear. And I want to first also say thank you to Morris Sussex Sports for restreaming this presentation. I can speak personally to, as an athlete myself, having recovered from an ACL tear, as well as being a physical therapist. So without further ado, we'll start the presentation. At any time, if anyone has any questions, there is a chat box. I'm just going to write something really quick in it. You guys get the idea, or we can get some conversations going. I'm happy to try and answer questions intermittently throughout the presentation, but if I miss it, I'll be sure to check the chat again and answer any questions at the end of the presentation. So I'll say good afternoon. Okay, so we'll do the overlay so people can see. So in case there's a question that comes up, I can show everybody what it is. All right. So I've done this presentation a couple different times just because this is something that I can end with, something that I experienced personally, as well as, you know, something that affects a lot of people. And that's why I feel like it's good to kind of, get the discussion out there, not only, why this is happening, but how it can be prevented. I used to play soccer in college at Santa Clara University, go Broncos. I also did a lot of other soccer teams, such as the Olympic Development Program, and played other sports such as basketball, track and field, and snowboarding team. So this is really common, especially for high school athletes. You play either on multiple teams or lots of different sports with overlapping seasons. That's a lot of activity leading to overtraining and ultimately injury. So that's basically what happened to me. I tore my ACL during the college tournament. I was devastated. I really wanted to play with my team that made it to the Final Four that year, and it it got me. Silver lining is it got me into physical therapy because I was like, I don't want anyone else to have to go through this, and I want to help them recover and return to sport. And so that's why there is a huge secret that at the time I was playing soccer that I was unaware of, in a way of preventing this from happening at all. And that way people can not only continue in participating in their sport. So today we're kind of focusing on lacrosse, but this can be applied in various sports. We picked lacrosse for today because, that's kind of the season, or spring season sport. And again, like I said, the secret not only helps keep you on the field playing, but you'll perform better in your sport. So I'd like to start off with some current research. So whether it's in research or even just having children or being an athlete yourself, ACL tears are on the rise. It's just something that can is just so prevalent in youth sports now, and even at younger and younger ages. So that's another reason I'm just so motivated to discuss this today. Current research showed that there's certain sports that are, and also if genders that are more likely to tear their ACLs, and it ranked it in order, first being women's soccer, and men's football, and girls basketball, gymnastics, and then also boys and girls lacrosse. Regardless of the sport, females were significantly more likely to tear their ACLs than their male counterparts, and also the injuries tended to happen more often in games than practice. So it's important how we practice, how we prepare ourselves for the games, that can help prevent these injuries from happening. So what am I going to talk about today? I know we talked about like the big secret that I'm going to talk specifically about, but you'll just have to stay tuned for. But in order to understand, you know, why this is a big secret and like why it's important, you kind of have to understand these other concepts first. Like, why are ACLs tears happening? Or how are they happening? Why are they happening? What do you do if you do tear your ACL? And then lastly, how you can prevent tearing your ACL, not only with there's some information there, but also like that big secret that I was referring to. Okay, so first topic, why do ACL tears happen in the first place? So the ACL is a ligament. It's a primary stabilizer of the knee. Ligaments attach bone to bone. They keep our joints from moving excessively in certain positions. So specifically to the ACL, that prevents inward rotation of the knee, excessive movement towards midline, and excessive straightening. You can kind of see in the top image here, those all three of those movements happening. When these things happen together and excessively, that's when the ACL either sprains or tears. And you can see the ACL here in the second image. So this can happen in two ways. That can happen with contact, such in football, you get tackled in the knee. But primarily, the injury happens during non-contact. Up to 90% of ACL tears happen in this way. And that's, again, a combination of those movements when running, cutting, changing direction. When these injuries happen to the ACL, it's usually not just the ACL that is injured. There's something called the unhappy triad, which includes, the ACL, the MCL, which is on the ligament on the inside of the knee, and the meniscus, which is like a cushion that's inside on both sides actually of the knee, but the inside one is the one that gets torn. Okay, sorry. Okay, so I have an example here of a non-contact ACL tear during a lacrosse match. It's pretty much at high speed. I tried to slow it down a little bit so you guys can appreciate, you know, what happens. So I'll make this bigger so everyone can see. So look at number 22 because they're cross right in front of him. It happens really fast. So he's just going to change direction to go infield, and those three positions happen causing him to tear his ACL. So there's no contact. Again, it's just playing the sport, trying to compete. Oh, here it comes again. Okay. So that moves on to my next point. Like, why are these ACL tears happening? So we know what positions put it at risk, but why are we coming into these positions, especially in a non contact situation? So technique is important. Like mentioned, movement, like how you cut, how you land from a jump. Typically, there's certain movement patterns and a way we move all our lives, and we don't realize it's a problem until there's a problem. So that's really important. Later in the presentation, I'll teach you like how to avoid those things. Alignment is a huge uh, important factor as well. Obviously, we talked about those positions that stress the ACL. So for example, females, if we have wider hips, so the tendency is for the knees to go inward, putting you in that risky position. Ligament laxity, so that can be determined by genetics or even for females where you are in your menstrual cycle. And then also muscle firing patterns. So sometimes, most of the time, athletes are significantly strong in certain muscle groups, but others are weaker or they have the tendency to fire sooner. For example, the quads, like primarily for soccer players and even lacrosse players, tend to fire first. And that again puts the knee in that hyperextension and putting the ACL at risk. These top four are things that we can control, or things that are in like within ourselves, like things that we necessarily can't totally control all the time. But what's a big factor is this fifth one here. And I'm seeing a lot of personally, because I have little kids, and then also just professionally with people coming in, is typically with any injury, it's issue between intensity and capacity not matching up. So intensity being the frequency, how like again, in the intensity like of performance versus what your body can tolerate. So I touched upon this in the beginning of the presentation. We're seeing an increase in year-round play of not only in you know necessarily multiple sports, but in one sport with different teams. So there's a single sport specialization, and that really limits recovery time and just even time for cross training, and which is really important to prevent any sort of injury, whether it's your knee or ankle or just general well-being. So, what do you do if you tear your ACL, whether you personally or if your child does, God forbid? So, we created a professional PT and training parent guide, and just give us a call or you can email us. Let's see, I put our email up here, and we're happy to send that to you. It basically is a timeline of from injury to surgery, what to expect, personally or as a parent for your child, just so you have the information, you feel more prepared and confident, as you go through the process. And I'm going to touch upon some of the highlights here. So, in terms of the surgery and the surgeon, there's generally kind of two general groups. So, you have an autograft, so that's harvesting the tissue from yourself to replace the ACL, or there's an allograft where you harvest tissue from someone else to replace your ACL. So the autograft can include like your patellar tendon or hamstring tendon, and an allograft tends to be the Achilles tendon of the donor. There's pros and cons to each type in terms of recovery time, any potential complications, and how strong the graft actually is. But what I generally recommend is you want to go with the procedure that the surgeon specializes in. There's one caveat to that where the hamstring graft, you're harvesting from a tissue or a muscle group that you're trying to strengthen. So, from a rehab perspective, I wouldn't necessarily recommend that option. Again, like every circumstance is different, but if I had to avoid one, that's the one I would avoid. One thing that I personally wasn't prepared for, and that is really important, is even just prepping yourself psychologically for the recovery and developing an injury recovery team. So that can include, obviously your family or any friends that have been through it. And there's lots of online resources. A former teammate of mine started the ACL Club. She suffered multiple ACL tears and just realized that there was a need. And the more support you can have, you can anticipate emotionally more what's in store. Like, still going to practices and not being able to participate and just kind of getting yourself in the right headspace, so you can recover better and not come back too soon, which significantly increases your chance of re-injury. So, in terms of the recovery period, on average, it's about 8 months. Obviously, there's variation depending on, the unhappy triad, how many structures are injured or need repair, the individual themselves, what sport they're going back to. So, it can be up to 18 months. Whatever the timeline is, you don't want to come back too soon. I think that it has to be criteria based, not timeline based. So if you can do that's what your physical therapist will kind of identify for you. You want to make sure that you are pretty symmetrical on both legs before you return to sport. Otherwise, it's too soon and you're more likely to re injure your either the same knee or even the opposite knee. So that's why technique retraining is really important. That also has to be addressed. So, you know, why did this happen in the first place? Was it a movement issue? Or does this person move in a way that's putting them susceptible not only to knee injuries, but other joint injuries too, such as the ankle and hip? So I'm just going to discuss a couple options that I found really beneficial personally and professionally as a physical therapist. And that includes the Alter G treadmill and functional training. So, what is the Alter G? The Alter G is a body weight controlled treadmill. We have Dr. J here in this video with one of our patients. It allows us to train the body in a way where it's less stress on the tissue, and that way you can enhance performance, whether you're injured or recovering from an injury or not injured at all. You just want to improve your speed or like your gait, your running form, that is. We get a lot of valuable information. So in the monitor here, we can see if there's any asymmetries in your step length or how much time you're spending on each foot. And that way we know what to do in terms of like exercises and functional training to kind of help you prevent these asymmetries and injury. In practicing this way on the Alter G treadmill, you can improve like your movement patterns I was talking about, like how you move and decreasing your chance of injuring other body parts. And again, like I mentioned earlier, or just previously, you want to you maximize your performance. Personally, I was trying to get better at my sport by, doing sprints after practice and stuff. And that was just kind of adding to the overtraining where if you're doing some speed training on the treadmill, on the Ultra G treadmill specifically, you can do it at lower body weight and that way you can still increase your speed without stressing the tissues. So I'm going to start this video so you can get an idea of what it's like. Okay. So Dr. J is here, kind of checking the various data points we were talking about. There's also a video camera in there, so we can investigate that way. And so that was from the back view, and so you can even assess here. I've found it just an amazing tool. Like, there's nothing better. I've had multiple athletes, regardless of sport, really benefit from using the Alter G treadmill. Also, in terms, you don't necessarily have to be an athlete. We use it for a lot of people that have balance problems and just want to be able to walk with confidence. So it's an extremely useful tool. We do offer free, visits to try it out. So if you want to, again, if you're interested in giving it a try, you can either call us. I'll put our number here and we can schedule a demo. Um, we usually don't even just have you jump right on the treadmill because there's certain things that we need to know before getting on. So that's why it's important to give us a call. If you live in the Madison YMC area, we'd love to have you come by. Or you can also shoot us an email if that's how you prefer to communicate. Okay, so on to the next topic. Oops. Okay, I touched upon this earlier. It said functional training or just exercises that help you move better are really important, not only in your recovery, but even preventing ACL tears to happen at all. So, what is functional training? What does it do? So, it enhances the connection from your body to your brain and back, just making sure, like, okay, you've learned to move a certain way all your life, and we kind of have to retrain those things. And even after injury, it's hard. Those muscle fibers and nerves they have to be re-educated in terms of how to move and and do it in a way that's where you're less likely to hurt yourself. Yeah, I mentioned like the muscle firing pattern, and also the foot and ankle is important too, like where with the knee being right in the middle, usually more of the issue is up in the hip or down into the foot and ankle, so we can identify those things with functional training. Typically, how this goes is we'll do more simple movements or exercises and then make them more complex and then more sport specific. And I have a video example here. So this is a patient at Dr. Andrews. She looks like a field hockey player. So you'll see in this first video, she's doing, usually we'll start with like a step down. That's probably the exercise that they began with, a lateral step down. Doing something a little more complex with the slider. Again, kind of focusing on control of the leg, making sure the knee is avoiding those excessive movements that we discussed in the beginning of the presentation. As you can see, depending on the field or the position, that left knee is having a pretty hard time staying stable. And these are also specific positions, especially with field hockey, that she'll be getting into. So she has to be able to get down low. Again, Andrew's demonstrating kind of where the knee should be as she comes around for the second exercise. So again, you want to always bring it back to sport. So and it's fun because this point it gets kind of fun. You can play a little game. Dr. Andrews having her run around and like, get balls and like again trying to watch the knee and make sure that it's staying out of those risky positions. Because really easy to work on be aware of your knee and very simple movements, but you always have to bring it back to sport. Okay, Sorry, trying to move on. Okay. Okay, so what is also really in preventing ACL tears is how are you recovering? Like, are you, and that can include two different areas. Are you recovering actively? So that's doing cross training and kind of like low intensity swimming in the pool, yoga, or being on the bike. Also, a great recovery tool and also a warm-up tool for also is the hypervolt percussive device, and that's up here in the picture in the right corner here. That uses vibration to help warm up the muscle tissues and enhances, that brain-body connection as well as improves flexibility. Obviously, there's passive recovery options, not necessarily just resting or taking days off, which are also very important. But we do feature these Normatec boots. We have them in office, and that uses compressive therapy to help with venous return or blood flow and kind of avoid any swelling and stuff. We do have recovery Saturdays, so if you'd like to come in and try them out, I highly recommend it. It's just a great way to, and something simple that you can do that doesn't take long to help you recover and prevent injuries to your knees and other joints as well. So lastly, we're getting towards that big secret I was talking about, like what people really need to do, and it basically ties all these things together. But what I there are some existing ACL tear prevention programs out there, and I want to provide those for you too. And if you understand the general concepts, you can kind of get the idea of not only how to do these independently, but also, maybe pass them on to a friend if they have children that play or their kids play lacrosse or any other sport that is kind of risky for these injuries. So one of them is the Shred uh, neuromuscular training program. So they have them for different sports, but this one I'll give you the link for is for basketball. And what it typically includes is a series of specific strengthening and flexibility exercises. They typically will focus on the hamstrings and trunk and hip abductors and internal rotator strength. Those are all muscles that help stabilize the knee or strengthen hips to stabilize the knee. You also want to maintain good flexibility of the hip flexors and the adductors of the inner thighs. That way, again, that you can be amazingly strong, but if something is tight, it's going to pull the knee in those positions that you want to avoid. Um, and so, in addition to these strengthening and stretching exercises, it's really important to include agility or those functional training things. So, that jumping landing technique is in a way that's less risky. So, I have an example here in this next slide. Oh, and I also wanted to give you the PEP program. So this is more soccer based. This is one of the first programs that came out. It just started when I was playing soccer, but if I was aware of this, I would have been doing this even before I started playing soccer. It's important to do this in the off season too. You could do it in season, off season, So again, it's like how we practice is determines how we play, right? So it's important to do those things. Okay. So going on to this example, so I had my niece volunteer. She's 13 years old, just starting to get into some higher intensity sports. And I just had my sister take her through these various things that's similar in these programs. Okay. Okay. So in the PEP program, there's a forward double and hop. I want you to watch this left leg. So you want to look at the knee window. So this window shouldn't close. And as you can see, as she jumps and lands, that left knee comes in and kisses the right knee. Other one is like single leg hops to the side. Same thing. You can check. You can see the asymmetry or the differences between the legs. So you could do this at home, personally, or with your son or daughter, and just kind of film it with your iPhone. Slow it down, and that way you can get an idea. It's like, am I or is my child moving in a way that's increasing their risk for injury? And it takes a lot of practice. So once we identify like there's an issue. You have to practice a lot to, kind of retrain these movement patterns. So this is a patient of Dr. Miriam's, and she's doing that front leap. Oops, here, gotta make this big. Okay. And as you can see, the knees stay in line with the toes. There's no closing of that knee window. And again, not only from an injury standpoint, but from a performance standpoint, if you're landing and moving in the proper alignment, you're going to move faster and perform better. So you don't necessarily have to be injured to do or recovering from injury to do these programs. It's something that you should do before you get injured, and you'll just play better. So I'm trying to move on to the next slide. Okay. Okay, so we are on to that big secret that I was telling you about. So, yes, these programs, they're extremely helpful. There've been studies on them. They're really important, but they're not specific. So what's important is depending on the person, depending on the sport they're getting back to, you really need to find a program or have a program developed for you specifically. So at Professional PT and Training, we have a sports readiness assessment. So whatever sport you play, we have myself or another physical therapist who are movement specialists look how you move. How does that relate to your sport? What kind of injuries are you susceptible to? And we create a specific program for you. And we're running a promo right now. These are free in March. This is a $275 value. I know that can sound like a lot of money, but the cost of surgery emotionally and just physically is such a deal. And I can't like emphasize this enough because it's just if my kids are still pretty young, they're just starting in sports, but we're already working on jumping and landing mechanics just because I don't want them to have to go through what I went through and so many of my teammates. So I'm going to check the chat. Let's see. Okay. All right, so I'm just going to go over one or two questions that I typically get. So more specifically to some of the products that I brought up. So there's a lot. Some people ask me, well, what do you think of the Theragun? Is that the same as the Hypervolt? Which one's better and stuff. So the Hypervolt is what we use in the clinic. It's the only percussive device that I know that research has been done on, and I really want to use like evidence-based or evidence-supported treatments. So it has been shown to be beneficial through research for, athletes in terms of improving performance and enhancing flexibility. Another question I get is about the Alter G. How is that different from water running? Like which one's better? So the Alter G is more specific. Like we get more data, obviously, that I talked about the running form. Getting in the water, you can't 100% control the body weight, or you don't even know really. So again, we can control progressions in terms of adding more body weight. Also, you can't get into the water right after surgery, and you can get a lot of surgeries, you can get into the Alter G pretty quickly. So it's something that we can start way sooner than you could doing water running. So, again, thank you for anyone that tuned in. I hope you have a wonderful rest of your Saturday. And